Taylor McCachran is a third-year occupational therapy doctorate student from Drake University in Des Moines. She is currently in her last semester of schooling and is completing her doctoral capstone project on individuals experiencing grief after a TBI and occupational therapy's role in addressing that. Please welcome Taylor.
Hi, everyone. Thank you for being here to listen to my webinar today. So like Courtney said, this webinar is about traumatic brain injury and occupational therapy's role in addressing grief, specifically grief that individuals with a TBI may experience due to a change in self-identity. My name is Taylor, and I created this webinar as part of my doctoral capstone project and to advocate for occupational therapy's role in this topic. All right. Okay. So the learning objectives for my webinar are that at the end of this, you should be able to first define what occupational therapy is. You should be able to define what self-identity is and how it's impacted after a TBI. You should be able to recognize how grief impacts one's daily activities or occupations and their roles. And you should be able to describe what occupational therapy's role is in addressing grief. So to start off this presentation and address the first learning objective, I'm going to give some background information on this topic. First, what is occupational therapy or OT? OT is therapy focused on the things you want and need to do in your daily life. Interventions use everyday life activities or occupations to promote health, well-being, and ability to participate in important everyday activities. Occupational therapy can be provided in a variety of settings, such as hospitals, outpatient clinics, assisted living or long-term care facilities, group homes, hospice, homeless shelters, community mental health facilities, work sites, and more. So like I said, occupations are everyday life activities. Another way of explaining what occupations are is that they're what individuals do to occupy themselves or to occupy their time. There are 9 different categories of occupations used in OT that are displayed in this photo. The first category up at the top there are activities of daily living, or ADLs. ADLs include things you complete every day, such as bathing, getting dressed, eating, etc. To the right, we have instrumental activities of daily living, or IADLs. These are more complex activities that you might complete frequently, such as meal preparation, managing medications, and grocery shopping. After that, we have social participation, which is engaging in the community and among friends, family, and coworkers. Below that, we have rest or sleep. Examples of this include things you have to do when preparing for sleep, or even the act of sleeping itself. Then we have health management, which is the most recently added occupation. This includes managing symptoms, nutrition, and managing physical activity. So this is really any activity you complete to maintain your health. Then we have play. This occupation is mainly addressed with children, but it's any activity that provides enjoyment or entertainment. Then leisure. This is any activity that typically an adult may participate in during their free time, so like any hobbies. And then we have the occupation of work. This can include seeking employment, preparing for retirement, or volunteering. And then lastly, we have education, which consists of any activity required for learning and engaging in the learning environment. All 9 categories of occupations can be impacted after a TBI, and it's important that occupational therapists address them. Okay, and before I dive into what a TBI is and background information on TBI. I do want to clarify that this information can apply to all types of brain injuries. My doctoral capstone project is specific to TBIs, but people with different types of brain injuries can also experience grief due to a change in self-identity. Okay, so a TBI is an injury that affects how the brain works. It may be caused by a bump, blow, or jolt to the head, or a penetrating injury to the head. There are three main types: mild TBI or concussion, moderate TBI, or severe TBI. Research shows that falls lead to nearly half of TBI-related hospitalizations. Firearm-related suicide is the most common cause of TBI-related deaths in the United States, and motor vehicle crashes and assaults are other common ways a person may get a TBI. A TBI affects each person differently because of the nature of occurrence, specific types of neurologic injury, their premorbid health, and their premorbid functional and social status. The symptoms of a TBI can be categorized into four broad domains. These are cognition, emotion, behavior, and physical. TBI survivors can experience a host of dysfunctions, including epilepsy, hemiplegia, amnesia, changes to their personality, as well as memory, reasoning, and motivation impairments. Now I'm going to share some statistics about TBIs. 1.7 million people experience a TBI annually, and it's said that adults over the age of 75 have the highest rates of TBI-related hospitalization and deaths of any age group. Many people are left with residual impairments in physical, cognitive, and affective functions after TBI. These impairments have led to about 80,000 to 90,000 people in the United States per year sustaining a TBI that results in substantial long-term or lifelong loss of function. Specifically for older adults, age-associated comorbidities such as frailty, decreased resilience, and less social support, in combination with those residual impairments, could result in worsened limitations. The lasting effects of a TBI are not only physical, but there's also lasting emotional effects. It's said that significant depressive symptoms are present in 1/3 of older adults with TBI. Participants in a study done reported significant changes in self-concept, with their current self being viewed negatively in comparison to their pre-injury self. The findings in this article also suggest that grief, and specifically grief for perceived loss or change of personal identity, might contribute to the experience of depression and low self-esteem after TBI. Okay, so now that I've mentioned the topic of self-identity, what is it? Self-identity encompasses our knowledge and understanding of ourselves, our relationships and social roles, and our self-evaluation. Factors that contribute to our self-identity that may be impacted by a TBI include understanding our personality, motivations, abilities, limitations, and potential, knowing the roles we play within the social environment and our social connection with others, and knowing our personal history. In a qualitative study done, it was noted that coping with change and self-identity was an issue that many people continued to struggle with for many years, long after physical recovery had plateaued. This problem of change in self-identity wasn't recognized for many individuals until some years after their injury, when formal health professional involvement had ceased. It was also found that 72% of 25 subjects said they had changed as a person as a result of their injuries. This change in self-identity or getting to know oneself after a life-altering injury is not limited to brain injury survivors, though. Any injury that results in sudden disability poses a challenge to self-identity. So although this presentation is specific to TBI, this concept can affect many others as well. The effects of a brain injury can cause many changes that can in turn affect someone's self-identity. Some examples of this are fatigue. This might make someone feel like a different person if they were used to being busy and active before their injury. Depression or anxiety. Someone might have issues with depression or anxiety since their injury, where before they didn't consider themselves to be an emotional person. Memory problems or changes. This may cause the survivor to lose core memories that affect how they identify themselves based on the life they had. An example of this is retrograde amnesia, which can result in loss of access to an accurate self-history. And changes in physical appearance can also have an impact on one's self-identity. Physical changes such as limb weakness or loss of function, mobility issues, ataxia, or sensory impairment might mean survivors have to use mobility aids and equipment. Using such aids make it easier for the others to recognize the survivor has a disability, but it can be difficult for the survivor to accept as part of their new self-image. Changes in gait, voice, or body shape can also result in people with a TBI being less recognizable to themselves and others. They might also have difficulties with aspects of self-care, such as washing, dressing, applying makeup, or exercising, that can contribute to changes in physical appearance. Individuals with a brain injury also experience grief and issues with self-identity due to comparing their past and present self. This comparison appeared to be typically prompted when they would return to familiar environments or return home, and they attempted to resume pre-injury roles and activities. It's said that this comparison of pre and post-injury self can be detrimental to one's sense of identity, and that the recognition of changes due to the injury can lead to greater negative feelings associated with their situation. In a study done about identity adjustment, even during the later phases, participants experienced a tension between their past and present selves. They continued on a long journey to reestablish their core sense of who they are in the world. So that brings us to the topic of ambiguous loss. Due to many individuals with the TBI experiencing a change in self-concept, they may grieve the person they were pre-injury. Ambiguous loss occurs when there is no resolution to a situation or normal focus for the loss, such as the death of a family member. It's also been defined as a loss that occurs without closure or clear understanding, and so it leaves a person searching for answers, which complicates and delays the grieving process and often results in unresolved grief. Another definition is it's been described as the most stressful kind of loss in that it defies closure. Other than brain injury, it has also been closely studied in cases of Alzheimer's disease, dementia, missing persons in New York after 9/11, and military deployment. Ambiguous loss can begin at the acute stage of brain injury rehabilitation, but it can also remain a profound focus of loss even years after the injury happened, for both individuals with the brain injury and those related to them. Ambiguous loss is not only experienced by the brain injury survivor, it can also be experienced by their family, friends, and more. The diagnosis of a TBI affects the entire family system, with research documenting increased depression, anxiety, and burden, in addition to significant role changes, financial difficulties, increased rates of substance abuse, and other mental health issues in caregivers. In some cases, the brain injury survivor may change after their injury, but be unaware of these changes. It might be their family, friends, and others in their life that notice the change. With traumatic brain injury, the survivor is physically present, however, psychologically they have changed, specifically in relation to their personality, their thinking, memory, and recognition. Family or caregivers, therefore, have to embark on a parallel journey of coming to terms with a new normal, as the person they once knew is forever changed due to the brain injury. In studies of marital relationships, ambiguous loss is frequently reported when a spouse must adjust to living with a partner who's been changed by their injury, and the familiar marital relationship has also been changed as a consequence. Family members may also experience ambiguous loss, but their experience of loss is different compared to someone with a brain injury because loss is so subjective. Part of this may be because the individual with a brain injury might not feel ambiguous loss as strongly due to impaired insight into the ways they've changed after their injury. Specific to relationships, just because one person is feeling a change doesn't mean it's affecting the other person the same way. This suggests that changes in relationships are individually centered, even though there are two people in the relationship. And even though two people are from the same family, they often report different experiences of loss. Therefore, individuals with brain injuries experience and feelings of loss don't transfer to their relatives just because they're related to each other. I'm going to now briefly discuss the stages of grief and the idea of a grieving period after a brain injury. The notion of a grieving period for the person with the brain injury was documented first in 1993, where cognitive deficits due to the injury were described as barriers to the normal grieving process and should be considered as essential to supporting someone through the adjustment process. So, cognitive changes or deficits after a brain injury can impact the grieving process or the stages of grief. The stages of grief are as follows. The first is denial. During this stage, individuals may be anxious, afraid, in shock and/or disbelief about their brain injury. Another stage is anger, when individuals may become angry when they realize the extent of their injury. The next stage is bargaining, which is when people make statements such as, I would pay anything to get better, or I promise something if I can get better. This stage does highlight some degree of acceptance of the condition. It also reveals persisting traces of denial that needs to be worked through. The next stage is depression. This is the hardest emotional stage of recovery to work through because one may feel hopeless, which decreases the chances they'll find and follow through with help. And lastly is the acceptance stage. When individuals develop a healthy acceptance of their condition, they'll enjoy higher self-esteem, a positive attitude, and a sense of hope for the future. There's no guarantee an individual will experience all of the above stages or in the exact order listed, but it's said that they will experience at least two of the above emotions before achieving acceptance. So how does this sense of grief or loss due to a change in self-identity relate to or impact our occupations or everyday activities? Occupational therapy theories actually suggest a strong relationship between identity and meaningful occupations. These occupations allow expression of an identity that each person holds dear and wants to convey to others. Identity is also central to a person's engagement in life through meaningful occupations. In summary, identity and meaningful occupations appear to be mutually dependent. Research indicates that the extensive changes to identity after a brain injury impact returning to previous occupations. Developing an occupational identity and participating in daily occupations is essential to our health and well-being. So, relearning how to engage in meaningful occupations such as employment, participation in civic life, and social relationships is a key process for individuals that can facilitate the development of self and occupational identity. Brain injury survivors report daily occupations that were completed with ease pre-injury were considered much more difficult post-injury. They also reported experiencing a sense of loss of the pre-injury identity described as a void or feeling of emptiness. This sense of loss or disconnection to the former identity impacted their occupational choices and would therefore have also impacted their occupational identity. Change in occupational identity may be in part due to the physical, cognitive, or social limitations brain injury survivors may encounter. When memory, reasoning, and motivation impairments occur, it can be difficult to perform former occupations. Therefore, relearning how to conduct daily occupations should be considered a priority. Occupational participation is said to enable better understanding of one's abilities and limitations, assisted in occupational adaptation, contributes to the process of identity reconstruction, fulfills various intrinsic needs, and holds unique meaning for individuals. Occupational participation is therefore important for improving one's sense of self and preserving their self identity. Changes to patterns of occupational participation and ability to participate in meaningful occupations following TBI have been shown to contribute to changes in self identity and their occupational identity. Persons with TBI often experience occupational gaps or discrepancies between the occupations in which they are engaged in and those in which they would like to be engaged in. Occupational participation plays an important role in the everyday lives of people living with the TBI, in reestablishing previous roles or discovering new ones, in the process of social and professional reintegration, and ultimately as an important mediator of overall health and well-being. Occupational participation also plays a role in achieving a sense of personal meaning following a TBI. It was found that the most significant predictor of post-traumatic growth was having a sense of purpose, which was most frequently associated with participating in occupations such as being employed, living independently, having social support, and being in a relationship. Therefore, the rehab process should focus on enabling individuals with TBI to perform and participate in occupations they want, need, or are expected to do in their daily lives, because it will in turn positively impact one's self-identity. The network of daily occupations, routines, and habits, which provides an individual's life with structure and meaning, has been lost because of the sudden event of the brain injury. It's important that the individual discovers or learns new ways to adapt the way they complete meaningful occupations or daily activities, which is where occupational therapy can come in. In an article, it was indicated that the adaptation process after TBI is first a necessary struggle to gain a new identity. This means that preserving and developing one's identity is at the heart of learning how to adapt to changes after a TBI. Second is it's facilitated by engagement in familiar occupations and familiar environments. This is saying that it's beneficial for individuals to be able to complete occupations that are meaningful to them in environments that they're comfortable or familiar with. The third point is that the adaptation process is a protracted learning process that continues long after rehab ends. This is saying that the adaptation process is a long-term or potentially lifelong learning process. And lastly, the adaptation process is individual and situated. The adaptation process after TBI is unique to each person depending on occupations that are meaningful to them, and so no adaptation process after TBI is the same. Along with adapting one's occupations after a brain injury, many individuals also have to adapt to a significant role change. For many individuals with TBI, the physical deficits aren't the most serious long-term effects. In a study done out of 134 subjects with a TBI, most of them had made a good physical recovery. Deficits in cognition and social functioning remained. Due to these deficits, this can lead to a severe role change. Role performance and balance are important factors in the quality of life experienced by a person with a TBI. So, what is a role? A role may be defined as the expected pattern of behavior associated with occupancy of a distinctive position in society. So I have a word cloud of some examples of roles up there. Um, Roles can include one's occupation, such as being a teacher or an occupational therapist. It can include their social relationships, so being a husband, wife, or friend. Their biological relationships, such as being a brother or a sister. Quasi-occupation, which includes being a volunteer or helper. Avocation, which is like an athlete or a musician, and their affiliation, such as being Catholic or a club member. Many experience important role changes that cause a decrease in self-esteem and quality of life experienced. So we've discussed how this grief or sense of loss can impact one's occupations and life roles. Now I'm going to discuss how occupational therapy is involved. We know that it's important to address the mental health of someone with a TBI sooner rather than later. Denial of changes is a relatively common response among survivors who begin to experience a loss of sense of self. The longer one goes without receiving some sort of therapy to address that, the harder it'll be to accept their new situation. It's also said that over long term, denial of negatively evaluated changes in functioning seems likely to increase rather than decrease the distress of survivors. OTs very much have a role in addressing mental health concerns such as grief. A little bit of history here, but occupational therapists actually initially provided services primarily for people experiencing mental illness and eventually evolved to include the creation of opportunities for engagement in meaningful occupations. Before World War II, most occupational therapists and occupational therapy assistants practiced in mental health, but by 1990, the percentage decreased to 11.8%. It's important that OTs continue to consider the mental health or emotional aspect when providing therapy to clients. Occupational therapy is known for using a holistic model or view when providing treatment, and it's important that we continue to use this lens. This model aims to view and treat people as complex whole beings, attending to emotional, cognitive, social, and physical aspects rather than honing in on isolated parts. Over time, as the medical model became more prominent in healthcare, OTs focused more on physical disabilities, which eventually led to a decline in the presence of OT in mental health. Therefore, with the medical model being more prevalent, services and supports focused on the redevelopment of an identity or addressing grief are often neglected in rehab, and the main focus is on the rehab of physical and cognitive injuries. So now that we've explained that OT has a role in addressing grief due to a change in self-identity, What are ways in which OTs can address this in practice? When doing research on ways OTs can address this, two common themes appeared. These themes were the importance of utilizing meaningful occupations in treatment and guiding individuals in adjusting to changes after a TBI. OTs must offer their clients meaningful occupations if their goal is to guide them in resuming the roles that are of importance within their unfolding life story. Therapists have to make efforts to understand the client's unfolding life story and personality in order to be able to create meaningful occupations because our personality influences our behavior. As stated earlier in this presentation, knowing that occupational identity and core meaningful occupations appear to be mutually dependent, OTs need to identify their clients' core meaningful occupations. They need to find out why they're meaningful, assess their client's ability to participate in those occupations, and determine their client's level of satisfaction with individual performance of the occupations. And the second theme I discussed was guiding the individual in adjusting to changes after a TBI. Some treatment ideas involve guiding them both to adjust to post-injury changes in functioning and to develop a new self-concept. Acceptance is said to be the critical factor in this process. Although it's important to guide them to adjust to changes, for many brain injury survivors, the goal of rehab is not to develop a new occupational or self-identity, but to integrate some aspects of their former identity within a new identity. To support them in bridging the gap between pre and post-injury identity, it's important to maintain a link between the pre and post-injury self. It's also said that maintaining one's identity or self-continuity is often achieved in the course of reconnecting with one's values, activities or hobbies, and social networks and roles. OTs can assist the brain injury survivor in reconnecting with these things. In addition, OTs need to assess their client's past and present life narrative so they can help their client develop their future narrative. OTs may also need to address issues common to the experience of identity disruption after TBI, including grief over loss of self, difficulty accepting identity change, depression, impaired self-awareness of deficits, and feelings of isolation from others. They need to be aware and observant of the signs of grief, and when there are signs, practitioners should encourage their clients to reflect on their experience and invite them to express their emotions. We discussed earlier how a TBI can lead to a severe role change or loss. What are ways in which OTs can address this? OT involvement will likely focus on having the individual define previous life roles or interests and the skills involved in each. Treatment goals or sessions could then concentrate on the development of these identified skills. For example, in a study done, the worker, hobbyist, and friend roles appeared at highest risk for loss after TBI. So to address those losses, an OT could focus on basic job skills and habits, socialization skills, and leisure tasks in their treatment sessions. Essentially, OTs should structure their sessions to enhance individual productivity and participation in a role or roles that the individual values and assist in reestablishing their identity by facilitating new role development. Social participation is one of the 9 occupations we discussed at the beginning of this webinar. After brain injury, there is a social identity loss and associated changes in social identity resources. Loss of valued occupational group memberships is also often reported. Research has been done on the impacts of engaging in meaningful group activity with others affected by brain injury. Group activity can be seen as a form of identity enactment. When brain injury survivors engaged in meaningful social activity, this supported social identity construction and improved individual well being. Belonging to groups and the support these groups offer are an important factor in life after brain injury. Social identity loss could therefore be countered with worthwhile group based activity. Increased social contact and connections with others, whether peers, family, or friends, were seen as markers of improvement and recovery by individuals with a brain injury. Therefore, OT should facilitate or address social participation to in turn positively impact one's identity. This can be done through assisting in acquiring new group memberships post injury or facilitating group sessions and treatment with others with a brain injury. In a research article I read by Glenn S. Cotton, they included a table with several fundamental treatment strategies that OTs could implement in practice to support identity redevelopment after a brain injury. So I thought I would include those in this presentation. Those strategies included encouraging clients to self-reflect on their experience of loss and to express their emotions, collaborating with clients on goal setting, incorporating core meaningful occupations and therapy activities, supporting a sense of identity coherence that bridges the past, present, and future self, encouraging clients to plan their future self, supporting the reframing of occupational competence by encouraging clients to explore modified or alternative ways to express their identity, teaching clients skills to support endeavors to manage their impairments and to rebuild their identity. So this can include problem solving, action planning, or accessing resources. Incorporating significant others, such as a spouse, parents, friends, or children, in treatment sessions to provide external validation and to support your client's sense of self. And including clients in group treatment sessions to increase self-awareness of impairments and to encourage acceptance of post-TBI changes. So after discussing in depth what OT's role is within this topic, I'm going to end off with some general tips from the Brain Injury Association that individuals with a brain injury can use to cope with identity change. First is getting support from others. This can include talking to your friends and family about your feelings. This can also help them understand any support needs you might have and also help you identify ways you can help yourself. Also, help your friends and others in your life to understand your brain injury so they don't misinterpret any situations. You can also get support from a professional who specializes in brain injury. They can offer things like talking therapies to help with understanding feelings or assessments to identify areas of difficulty that might be contributing to your identity change. You can also talk to your general practitioner about getting a referral to a brain injury specialist, or if you feel you'd benefit from rehab. Connect and share your feelings with others affected by brain injury, whether through support groups or online communities. It's also important to understand the effects of your injury and how to cope with them as a good starting point. It might help you to overcome difficulties you're having that are contributing to your change in identity. Another tip is to find activities to keep you busy, whether it's a new or old skill or hobby. Identify your values, what's most important to you in life, and how can you continue to live by your values after brain injury to help with giving your life meaning. Use creative ways to express how you feel, such as art, music, dance, or writing. Find new ways to do things that were important to your identity before your brain injury. And then their last section of tips was titled Keeping Things in Perspective. The first statement was that many survivors struggle with their changed identity because they feel like they've lost something. While this is perfectly normal, try to also reflect on whether you've gained anything or whether there are important aspects of your life that have remained the same. Remember that no one's identity stays the same forever. It's constantly changing over time, depending on life circumstances. Think about your goals and aspects of your identity that were important to you before your injury. Is there any way you can continue to work on and fulfill these with support or adaptations? If it's more realistic to set new goals, think about what's important to you and what you want to achieve. Remember that while things can be difficult in the early stages of injury, things can and do improve for many people over time. Oh, and over time, you might discover new strengths that you can celebrate, such as resilience. Remember that being a brain injury survivor is only one aspect of who you are as a person. Don't forget about all the other important aspects. Remind yourself there's no set standard for what you should be doing in life, and everyone's circumstances are unique. Avoid comparing yourself to other brain injury survivors, as no two experiences are the same. All right. And here are my resources. That is the end of my webinar on traumatic brain injury and OT's role in addressing grief. Thank you for taking the time out of your day to listen. And if you have any questions, I would be willing to try to answer them.
That was wonderful, Taylor. Thank you. I've been watching the chat box and there haven't been any questions that have come in.
Okay.
You have some praise coming in though. And well, thanking you for presenting. Um, if there are no questions, again, this recording will be shared to our YouTube page, probably within the next day or two. And again, I've shared the feedback link in the chat box a few times. If you take a moment or two to fill that out, that would be wonderful. Thank you all for making time to be here today. And Taylor, again, thank you for your expertise in sharing such an important topic with us today.
Yeah, thank you for having me.
Yes, thank you so much again, and have a wonderful day, everybody. Thank you, Taylor.
Mhm.